Hello, this is Dr. K, hair transplant surgeon from Turkey. Today I'm going to talk about how to approach male pattern hair loss. First of all, we have to understand the physiology of hair loss and how it occurs. Hair loss begins, we don't instantly start losing hair. The initial stage is what we call the miniaturization phase, and in this phase the hair becomes thinner. So the hair is not immediately lost, the thickness of the hair is lost, and thus the coverage is reduced. Now, if we make a scale of density between 0 to 100, we generally don't realize until our hair loss reaches 50%. And that's a significant amount. So when in that region where hair loss is between 100 to 50%, most of that hair loss is attributed to thinning, that's miniaturization. So if you kind of go under the microscope and count the number of hairs you have per area, you'll find a similar number to the original density, only that the thickness of the hair is significantly reduced. After that, these hairs permanently die. So when we reach below 50%, we also see a significant reduction in the number of hairs. The second thing is we have to diagnose the pattern of hair loss. Now, this hair loss can be a localized type of hair loss, as in, for instance, receding of the hairline, where we see the hairline receding like a shore, or a bald patch being created at our crown, or both of those happening at the same time. The other type of hair loss is the diffuse pattern. In the diffuse pattern, there is some type of thinning going all across front to back. Now, whichever type hair loss you have predominantly determines also how we approach the treatment. Also, we have to understand whether this is a mild hair loss or an advanced hair loss. Now, to generalize, mild hair loss is the hair loss whether you can treat with only medicine, or even if surgery is necessary, the prediction is that the donor capacity would be sufficient to give a decent amount of coverage, if not a full head of hair, throughout one's life. Or it can be advanced hair loss. And advanced hair loss means the donor capacity will not be able to give one a full head of hair, even if it seems that the donor hairs can fix the problem today. That is, if we predict advanced hair loss in the long run, even if we think we can fix the problem on that day, we know that the donor resources will be insufficient in the long run. The treatment options can be medical treatment, which means using medicine, or it can be surgical. However, there's one thing we need to understand is that surgery does not prevent hair loss. So in reality, surgery is not the treatment for hair loss. It's the replacement for lost hairs, but it's not the treatment for hair loss. The treatment of hair loss is medical, so you can only reduce your hair loss, slow down your hair loss, stabilize it by using medicine. After that, there is the planning and design. So this includes a long-term plan considering the progression of hair loss. And the design includes all of the considerations that I mentioned previously, like the patient's age, hair loss pattern, hair quality, etc. The goal is to stabilize hair loss, to improve coverage while retaining a natural appearance, causing the least amount of tissue damage and scarring, and using the donor's resources economically. In this video, I tried to give you a general overview on how we approach male pattern hair loss. I hope it has been helpful. Thank you for watching this video, and I hope to see you in the next educational video. Goodbye for now.